This is a time of hardship for everyone, but again, we're not at the point where we all need to be, super panicked or alarmed. There's a lot of common sense things that we can all be doing to decrease everybody's risk level. Everyone has a role to play, and that really arms us and empowers all of us to be a part of the solution. Because once you know that somebody has a respiratory problem, then you know that they need to shelter in place, that they absolutely need to stay at home, and that they really will need to just do some very common sense kind of things to make sure that their household and their community doesn't get that same infection. So I know it's disruptive, it's inconvenient, and I know that it's really having to change how we live our lives. But again, we're following really successful models in other countries and in our own history when we had outbreaks in the past where all of these social distancing measures really were able to kind of flatten the peak of how many cases were seen. A lot of people are understandably concerned because when you read the headlines, obviously, only the bad news makes its way to the very top. I think we also have to take a step back and say, look, we are not experiencing the same level of medical emergency that is going on in other places around the world and around the country. And so our level of threat and our level of urgency should really just match what we're seeing here. And as things get worse, we need to obviously we do need to respond to that. But I just don't want everyone to just be in full panic mode all the time because that's exhausting. Not everyone has an equal risk of acquiring COVID, and not everyone has an equal risk of having a bad outcome from getting COVID. And so you need to just evaluate your own situation and say, have I been out of the country? Have I been to a place even within the US where there is a lot of this community transmission going on, which would put me at higher risk? Because if you don't fall into one of those categories, then you're really not at risk right now of acquiring this COVID infection.
80% are gonna have very mild symptoms. They're not gonna get sick, they're not gonna need to see a doctor, they're not gonna need to get admitted into hospital. People who are getting ill, are dying from it, are people who are more than 65 and plus. And the highest mortality rate right now is 80 plus. So that's something to keep in mind.
The truth is most people just need just a few days of just taking it easy. And now with all of these emergency declarations and the shelter in place, hopefully a lot more people have an excuse to just take it easy. The minute you develop symptoms, don't rush to get a test. Rush to go watch TV. Just go sit on a couch, drink a lot of fluids, make some chicken soup, and just chill out. And your own immune system fights viruses. You just have to give it time. I bet this is the most closely tracked infection in the history of humankind. I mean, we know where every single case is happening, really at the minute that it happens around the world. And that's never happened before.
There's a lot of fear right now. That's what we're mainly seeing. A lot of people don't understand the disease completely yet. There's a lot of information out there on social media, on news every day, and the news is changing every day. There's a lot of numbers being thrown out, and some of them are correct, some of them are not correct.
With the flu, we have a vaccine. And with the flu, the incubation period, which is kind of the biological property of that virus, is much shorter. So the incubation period for the flu is like 3 days, maybe 5 days. This virus, it's challenging us because there's not a vaccine and the incubation period is longer. It could be up to 14 days. So that just means that we just have to watch people longer before we can clear them.
It's not that we don't have viruses before. We've had SARS before, we've had MERS before, and we have had Ebola before. The difference between those diseases and COVID-19 is that COVID-19 is more widely spread and it's gone everywhere. Whereas the other diseases, we were sort of able to contain them to one country or few different countries in a region in the world and not have it all over the world. And one of the biggest things I think we're realizing, and the reason why that was the case, is when you got SARS or you got MERS or you got Ebola, people got so sick so fast, they couldn't get out of their bed and leave and walk around. Whereas most of the people who are gonna get COVID-19, they're gonna have mild symptoms. So they're the people who think they have common cold, but they have traveled to high-risk areas and they've already had an exposure and they don't realize it. So what's happening is they're traveling, they're going on airplanes, they're visiting their in-laws or they're visiting their grandparents, and they're spreading the disease.
Really, the minute that you get sick, be aware of that. Don't panic. Most illnesses, even if they are COVID-19, are going to be very minor. And right now, the chances that you have COVID-19 are super small if you're just a member of the general public. So if you do start to get the sniffles or a tickle in your throat, then just, pay attention to your own body. If you just take care of yourself, chances are you are going to feel rapidly better in just a couple of days. So, if you can walk and talk and do all of your activities, you might have the crud, you might feel under the weather, but really if you can take care of yourself, at this time, please do. Because the worst thing that you could do is spread this infection to people that are frail and ill at the hospital, take up a bed that somebody else could be using. We as doctors are making the best decisions that we can, but we need all of our public, all of our civic leaders, all of our teachers, all of our parents to understand that this is a time when all of us need to come together as a community so we can work together and really understand that there's high risk and then there's not high risk. And it's really the high risk people that need medical attention right now. Obviously, at Public Health, we're watching that situation very closely. We are alerting the public every day with the case counts that we have.
Much work is happening. Many dedicated people are working hard to prepare and to ensure that vital services continue in spite of some of the restrictions that we're recommending to prevent the spread. And as we all know, the pace of the spread is what we're really trying to limit. We know that in other countries, that pace, the quicker it is, the harder it is for hospitals to keep up. And so we're really just trying to slow it down so that our resources don't get overextended in a short period of time.
We obviously are watching the terrible things that are happening in China, Europe. It's very concerning. I mean, there's some real tragedies that are going on there. What I think we should also look at is that there are some countries that have really beat this thing. And they have really done a good job with controlling their numbers and flattening the curve. And what did those countries do that was the right thing to do? Well, they implemented these social distancing measures and they really made sure that everyone knew to wash their hands, stay 6 feet apart, to really do all the things that the CDC is advising people to do. They got that done as early as possible.
I think one of the biggest things we did early on was to be able to contain it. The people who had traveled to high-risk areas and came back to Fresno County, we got in touch with them early on and said, you need to isolate yourself and please try not to, go visit people and be around, especially if you have symptoms.
And we're trying to get all of the resources in place because we know that we're going to be seeing more cases of this COVID-19 happening here in Fresno County. So we understand that, as our numbers start creeping up, that we are going to be stressed about, how much medical supplies we have and how much we can really care for people that are critically ill. And that's why we need to minimize those numbers. The national experts at the CDC are saying that this is an infection that people spread from person to person whenever they're sick. And when you call the health department, we'll tell you, if you're older than 65, if you have other diseases, if you've got a history of immunocompromise for things like cancer, those are the people that we really do want to get tested and checked out. But for the rest of everyone else, stay calm, stay away from other people, and stay hydrated.
Maybe getting off of social media at this time would be very beneficial, and then going to the sources that are actually putting out facts out there. So going to our website, going to the CDC website. CDC actually is doing a great job. So if you have a particular question, you say, hey, I have a person at home who has a runny nose. What do I do? If you put in family member with COVID symptoms, CDC, they will take you to a page which says, what should you do if your family member has URI symptoms? And it walks you through exact steps, what should you be doing?
We know that when you're feeling anxious or you're feeling concerned, that the way to counter that is with facts in a time like this. So it's really important for you to find a trusted resource. We recommend our own Fresno County Department of Public Health's website. We also have social media pages through the Department of Public Health and Department of Behavioral Health and the County of Fresno, where we're sending out updates regularly and links to really important resources that can help you as you're managing your own life as you go through this period of time.
Really, we just want to support the whole community and make the community healthier and keep them safe. And that means, working with all of the general public, obviously also working with our partners in medicine, and really reaching out to city leaders and county leaders who are working with the public, because we know we all need to work together to safeguard the health of the public.